Hello, my name is Mark Blocker. I'm the president and CEO of Christian Healthcare Centers, and we're a direct patient care medical services organization that's headquartered in Grand Rapids, and we also have an office open now in Newaygo. In this webinar, I'm going to address some of the issues in our healthcare system that drive up the cost and undermine the ability of patients to get timely medical care from a doctor that has the time to take care of them. To begin, medicine is for the patient, not the payment. Seems like too much of modern medicine today focuses more on the payment than it does on the needs of the patient. And if you've ever been hospitalized, I'm sure you're familiar with the torrent of confusing bills that land in your mailbox about a month later. Just about anyone who has had the slightest thing to do with your care sends a bill. You get a bill from every doctor that stuck his head in your room, to the respiratory therapist to ask if you were breathing okay, the lab tech who tapped a vein, and the janitor that emptied your wastebasket. Although I'll admit I exaggerate on that one, but you get the point. It's frustrating. And sometimes you get those bills and you look at them and you wonder what in the world is this whole flood of numbers and codes and abbreviations. What does that mean? So imagine flying somewhere with a commercial airline, and a month later you get a bill from the ticket agent, the gate agent, the baggage handler, the pilot, co-pilot, and every one of the flight attendants. You'd shake your head in disbelief, rightly. No other industry besides healthcare operates that way. In no other industry do prices vary by a factor of 10 or sometimes even more, except for healthcare. The cost of my iPhone or a Prius or a laptop doesn't change because of from one seller to another. The cost doesn't depend on who your employer is or whether you're employed or unemployed or self-employed. The price is what it is, but not in healthcare. Despite living in an age of medical wonders, the way we pay for healthcare is ridiculously expensive. It's inefficient, it's fragmented, and it frustrates both doctors and patients. And when sickness and disease strikes, we're all vulnerable to medical extortion. And yes, I did say extortion, because like I just referenced earlier, who among us has not received a medical bill or a confusing explanation of, quote, benefits from an insurance company with its verbiage about in-network and out-of-network payments and non-payments and co-insurance, and then the endless phone trees that we have to walk through trying to get answers or even a live person on the phone, only to surrender too often in frustration and write the check, lest we get sent to collections. So we rightly wonder why a simple series of blood tests for our annual physical can cost $500 unless you're insured, or why it costs $3,000 for an x-ray and a few stitches at the emergency room. Why does it cost $3,000 to remove a small lump on my arm or $50,000 for an outpatient surgery on my foot? And where does all that money go? Increasingly, the money goes to people who have little or nothing to do with the care you receive. It doesn't go to the doctors. Although the number of doctors has only increased 2% in the last 20 years, the number of non-medical administrators has increased 3,000%. So it's no wonder that healthcare in the United States costs $3.5 trillion every year. Too much of modern medicine is devoted to capturing payments rather than caring for patients. And that's one of the reasons 61% of Americans carry medical debt on credit cards. Over half of all personal bankruptcies are due to medical debt. So where's the virtue in a healthcare system that can restore someone's health, but leaves them financially devastated? You talk to any physician today, and they all have stories about how their patients who could not afford care that they needed, or insurance companies denied authorizing a certain prescription medication that the patient needed, or they wouldn't authorize imaging or a procedure or surgery, or the patient whose frustration with navigating our expensive, fragmented healthcare system resulted in they just gave up and didn't seek any care. The more healthcare has been tied to insurance reimbursement, the more patients have come to depend on it, which results in the cost continuing to climb, exceeding the rate of inflation year after year, even in 2022 when inflation is raging and driving up the cost of everything. I cannot think of another product where the price increases because it's insured. My homeowner's insurance doesn't cause the price of my house to go up, nor does auto insurance raise car prices. But healthcare costs increase the more we insure it. And consequently, with doctor compensation tied to insurance reimbursement, we've conditioned doctors to focus more on the payment for their services rather than on what their patient needs. So how do we change that? One approach is the model that we at Christian Healthcare Centers have been pursuing since 2017, and that's direct patient care. What's that? It's a model of healthcare delivery that's catching on with doctors and patients throughout the United States. And it, frankly, is very simple. It's a relationship between the doctor and the patient and no one else. It's a model that consistently delivers better care at lower cost than the typical insurance-based practice. Simply put, for primary care, which entails nearly 90% or more of the health care that the average person gets every year, direct patient care functions like a gym membership. Instead of using insurance with all of its deductibles and copays and in-network and out-of-network and all of those insurance-related hassles, with direct patient care, you pay one small monthly fee, and that provides unlimited access to all the services that are offered in that medical office. So there's no nickel and diming patients for every little thing. If you get an EKG, you have a blood draw, you need an injection, you need an X-ray, there's no extra charges for that. No extra charges, copays, or deductibles for office visits, telemedicine, as I said, X-rays, acute care medications, mole removal, and many other common in-office procedures. You get less time sitting in a crowded waiting room, more time with your doctor, and you actually get a doctor who looks at you instead of tapping away on a computer. So that describes in a broad way the member care program at Christian Healthcare Centers, where we focus on the patient. One of the things we do that's different is we schedule 30, 60, 90-minute appointment times. We don't limit people to how many questions they can ask us during a visit. We have convenient access by telemedicine. So if you live at a distance, and we have people that come to us from 32 different Michigan counties, some of them as far away as Illinois, Peoria, Illinois. We have people in other states. We have people up on Mackinac Island in the Upper Peninsula. We give them convenient access by telemedicine and virtual visits, so they don't have to come down for simple things like a child with pink eye or strep throat and those sorts of things. We offer a real doctor-patient relationship that's supported by a dedicated staff whose sole focus is caring for you. So our goal really is to keep you at your best, not just see you at your worst, because that's the way healthcare is meant to be. Now, our daughter organization, Christian Healthcare Specialists, even provides lower cost in-office procedures and minor surgeries that save even more money. And I'll talk about that in a further webinar. But basically, we are able to save our members on average each year about $1 million that they would have had to spend out of pocket on their healthcare, whether primary care or in many respects specialty care. So if you'd like to learn more about this kind of healthcare, you can check out Christian Healthcare Centers at www.chcenters.org. We have 2 locations to serve you, Grand Rapids at 3322 Beltline Court, or in Newaygo at 53 West Wood Street. So I want to thank you for joining us today. Feel free to reach out to us with any questions or to schedule a time to stop in for a tour and to meet our staff. We would love to meet you. Thanks for joining us today.